what is OCD? OCD is complicated. So it's not really an easy thing to answer. But really, one of the things that it really means is that it's like an overdue mechanism to calm anxiety. So people do obsessive thinking and they do ritualistic behaviors so they can calm their anxiety. So now we're talking about the virus that's going on, and not all OCD people are affected by the virus. So it's not all OCD people. So obsessive compulsive disorder, OCD, patients worry that they're too close to people. Somebody coughed and they worry and obsess they're gonna catastrophize and kill somebody, kill themselves. And when it's really a problem is when people become dysfunctional. And by dysfunctional, we mean, I had a fellow came to me about his wife. He'd say, I can't stand it anymore. It takes her an hour to leave the house. She's got to check things 10 times and then maybe she could leave. And if I interrupt her, then she has a fit. Now, she's so dysfunctional, it takes her hours to do things it could take minutes to do. And she has no routine. So this is what can happen with people whose OCD is out of control. So that's kind of like what it looks like. Somebody who suffers from OCD, and when people come to see me, I ask them if they have any obsessive thoughts or ritualistic behaviors. And that's really kind of like the cornerstone of what we're talking about. You know, that people have checking rituals, you know, they have to check things or they have to clean things. So usually obsessions are thoughts, you know, that you think that things aren't right and you worry and obsess about it, you ruminate and you can't stop thinking about it. And the compulsions or rituals, they're like things that we just do again and again so that we could try to calm ourselves, like hand washing. I have some patients that wash their hands, use a bar of soap a day, and they have sores on their hands. Now, because they're trying to wash all the germs off their hands. Now, you could see, obviously, that this is a dysfunctional behavior, and that's really what we call a compulsion. So I think that kind of sums things up with that. But really, when we think about it, it's like when people have long patterns of these things, then we have the disorder. You know, sometimes people call others, oh, you're acting OCD. That could just be a trait, an obsessive trait. Doesn't mean you have the disorder. And if you have the disorder, doesn't mean that the virus is going to get you. If you really have OCD, then you really need professional help. And why? Because it gets to be a devastating illness for people. And, you know, normals can tell that people have a problem and they're just out of sync with others. So if you see you're really having, the ritualistic behaviors, the obsessive thoughts that you can't manage, and you're unable to sleep and you're unable to function, then you really need professional help. Now, what does professional help have to offer? Because nowadays, there's a lot of good OCD therapies, and we don't have to go into all of them here: aversion therapies, behavior modification therapies, cognitive behavioral therapies. Then there's also what I do a lot of, because I used to see people when I started my practice many years ago in extensive therapy, and it was very tedious, and usually I didn't get very good results. Then with the advent of some of these serotonin reuptake blockers like Prozac, it's been like a miracle. I have a tremendous success rate in med management. but I need very compliant patients who really want to go the long route, because to be on a Prozac, you need high doses for long periods of time, and the disorder appears to evaporate. But so, I mean, there is now medical management, and there is also the therapies. But there is hope out there, and I have successfully treated many patients. The med management with conjoint therapy does miracles for this disorder. So there's a lot of hope out there, so get some help.
BregmanMD Medical Group offers online psychiatry and online therapy.